Do you feel that you're consistently walking on eggshells? Like, do you feel like no matter what topic comes up with your partner right now, the two of you are butting heads and you end up feel like you're walking on eggshells? Now, to be clear, walking on eggshells is when you tiptoe around difficult topics. You don't approach them. You don't talk openly or honestly about them because you don't trust your partner's reaction. Your partner in the past may get angry, may get defensive, may begin insulting you, and it turns into a big row that you are not prepared for. When all you really want is to be able to sit down with someone who's logical, and when problems come up, tell them the problem, open up the whole resources to what you could do, and actually work through the problem together. I have some examples of what it feels like when you're walking on eggshells, because oftentimes when my clients come in and they tell me we're not getting along, my partner has just gotten so defensive and they want to blame, they blame me, they blame everybody else instead of taking responsibility. I'll ask them, do you mean you're walking on eggshells? And they're like, well, I feel like that in a way, but at the same time, I'm not scared. When you feel like you're walking on eggshells, you actually begin dreading the conversations. You do feel threatened more that you're going to be put down or insulted. It's usually an emotional threat. Although if it's physical, that's even worse. And in that case, you really do need to take action fast. But let me just give you some examples first. A partner that gets angry at the slightest provoking, angry outbursts and complaints that are blown way out of proportion, verbal disagreements, or even assaults that become staples of the relationship. In fact, it's becoming consistent. The fights you have are no longer infrequent, they're frequent. The partner places a constant guard up against around you and around other people. Like they withdraw very quickly. Fighting or physical blow-ups becoming unusual in the relationship. They may get a little physical in the sense that they take your arm or something. May not be, may not look like abuse or sound like abuse, but you know the difference and you know it's acute. That is a physical altercation. The abusive partner refuses to take responsibility for their part, their actions. Once again, they're about blaming. Physical intimacy is not enjoyed anymore. Caressing is oftentimes not enjoyed anymore. Reduced confidence and a sense of well-being in the partner who is being abused. And in this case, that would be directed to you. When you start feeling like you're not well, like you no longer trust this person, the relationship has been damaged, almost feels like a betrayal of sorts of who this person used to be, that's a good example of how it may feel if you're in that process of walking on eggshells. Now, do you have to live in this? No, you don't. In most cases, if you will seek help with a professional counselor, you will be able to get help, sometimes even turn it around. But if you're on your own and you don't have a therapist, I've got some things I want to suggest to you. First of all, I want you to communicate with your partner. I want you to sit down and without, hinting around, I want you to directly say, I feel like we have changed. I feel like I can no longer come to you and really share my feelings without you getting very angry, upset, defensive, or blaming. And it's important that you ask them then, how are you feeling? And you might get a lot of vitriol, a lot of anger, a lot of overwhelming stress, but this is important. I want you to journal it. I want you to write it down so you have a calendar or you have something to go back to should this go further with a therapist or whoever it would have to go to. Secondly, figure out your true emotional needs. compare what you're getting now with what you want. So in this case, it might be something like, instead, I want a partner who, when I raise a situation or a question or something stressful that's happening to me or something we need to address with the kids, they can sit down with me and they'll say, let's talk about this. Let's brainstorm together. What can I do to change, and what could we possibly change about our lifestyle or our relationship? If that's what you truly want, you compare that to what you're getting now. I'm getting someone who I can't even talk to because they go into a rage, or they get threatened, or they play the victim role, or they play, the blaming, insulting role, or they just totally stonewall or withdraw. That's important for you because that's going to help give you the impetus or the motivation to move on if you need to. If this partner is already classified as being emotionally or physically abusive, speak to friends and family for support. Tell your friends and family what you're feeling. Be careful not to blame your partner. It's important they know your feelings about it, your perspective about it. They may be able to help. They may be able to validate you and say, yes, I've seen the same things lately. I think something is going on. And then talk to your partner about getting professional help. I say this because I want you to try and encourage your partner to get their physical exam, which is a medical doctor, as well as see if that doctor can refer them to a counselor. The reason I always start with an MD, a wellness doctor, is because a lot of different disease processes start with a mind change. A patient may get very negative. A patient may get depressed. A patient doesn't feel good. They're more irritable. They're more annoyed. And things like hypertension, diabetes, some of the cancers present that way. So it's very important that your partner goes. If they've not gone to the doctor, that might be a lovely place to start, because most people will take care of their body. It's their mental health that they're more defensive about. They aren't willing to talk to someone. And so let that relationship they have with their family doctor help ease in to perhaps getting a therapist. And a good way to start that is if the physician is able to say, you're just really stressed out right now. You've got a lot of stress, and talking to someone who's a professional who can help you, give you strategic plans for that is going to be worthwhile. They'll usually try it then. Speak to a therapist yourself. Make an appointment. Tell your therapist exactly what you're feeling, what you're sensing, and let that therapist help guide you into talking with your partner one-on-one, or maybe bringing the partner in. Or maybe that will mean moving on for you. The most important thing is you do diligence on the part of reaching out and trying to get the support and care you need. This helps clarify your mind. It helps you make wise decisions, so you're not just reacting to your partner's reaction. If this video is helpful for you, please subscribe. And if you're already a subscriber, thank you so much.